Hi everyone, Michelle Lyons back with you again. I am so pleased to be joined by the very fabulous Miss Debbie Dillon, who is probably I would say probably one of the most expert people I know when it comes to psychosexual health, for both women and for men. So a couple of months ago, Deb's reached out and asked me to come and speak at her Glastonbury Pelvic Health Festival, and that was an easy yes.
Yeah,
so I'm really happy. So I thought we should have a little chat about it so we can tell everybody about all the fabulous things that are going to be happening there. Because there's lots of other great speakers apart from me. So hopefully I won't lower the tone too much. But Debbie, where did you get the idea from?
So hi Michelle, fantastic that you agreed to come over. So we're absolutely delighted and very excited. I've spoken about this for a long time to you and mentioned it. I just feel I'm always traveling to courses. I love learning. Every course you do, you end up getting another question that you need answering. And so there's so much information out there. And I decided it's quite nice to do kind of more conference feel, that you have different speakers. Because, we've different levels, people, and I'm also really want to get people to come into this area as well as people who are already in it. So that's kind of why that vision came.
Brilliant.
And then it ended up being Glastonbury because I got a good place to host it. So that's how that happened.
So in years to come, when Glastonbury Music Festival has long been forgotten about, people will still be talking about Glastonbury Pelvic Health Festival.
Which would be brilliant.
I think so.
Yeah, it'd be great to get it going in the future. That would be awesome.
Absolutely. Well, I think it's a brilliant undertaking, and fair play, because it's not an easy job to try and organize presenters and venues and everything. So thank you for putting it all together. Who else have you got coming?
So we've obviously got yourself, which we are super excited about. So that is just awesome. And you're doing 2 pieces, so you can tell us about that in a minute. We've also got the fantastic Elaine Miller from Gusset Grippers.
Brilliant.
Who is going to speak and talk about comedy and getting the word out there. And also she's doing a research on that as well. So she's going to tell us a little bit about that. And then we have Elaine also doing her gig on the Friday night to kind of cement the 2 days together. Lovely. So that would be fantastic. We have the amazing Louise Field from Adore Your Pelvic Floor, who is super, and her energy is just unreal. And so we're getting her to come in and speak on the collaboration with fit pros and physios and health professionals, because I think that is definitely in the UK, it's a huge missing area. Yeah. And so we need to use those people to get the information out there. So I just think that it's so important. So that's how that came about. And the reason Adore Your Pelvic Floor is because she also treats men.
Great.
And so that's also men as part of that, which is, as you well know, I treat a lot of men. So that is one of my big kind of areas that I'm really keen that we don't forget about.
Yes.
And then because of my big interest in sexual dysfunction and into the psychosexual medicine side, I decided, well, I have to do a little bit because I'm always being asked. So I thought, well, no better place to start with the one I'm sorting out myself, in my own comfort of Glastonbury.
Good.
So that would be great. And then, so that's on the Friday night. And then the Saturday, we have the most amazing Craig Allingham, who Lovely. I can't wait to meet. Because he is just awesome in everything prostate. Himself and Joe Milios are just fantastic. So I've been to Joe's course, and it just happened by chance with Craig that I asked about his books, because I buy his books for my patients, and was like, when are you coming? And so it just all ended up slotting together. So fantastic. So super excited.
It was destiny. It was meant to be.
Yes, exactly. So so on the 20th and 21st of September.
I think it's amazing. I had the pleasure of meeting Craig and his wife, Mary Rose O'Dwyer, a couple of years ago in Australia. And, what I love about Craig's approach is he comes at it from very much a male perspective, because I think, probably we both agree that any male pelvic health course we've ever been to, it's primarily women at it, and primarily women teaching them as well. And I think it's so valuable to be able to get a male perspective on male pelvic health, And I think he's an excellent speaker. I've heard him present on podcasts and on various different platforms. So I'm really looking forward to hearing him speak. And then what specifically are you going to be talking about?
I'm not.
Just give me 1 second. So, Deb, do you want to just tell us what exactly you're going to be talking about? Because I'm really interested in your perspective on psychosexual health.
So I feel just to do a session on psychosexual medicine wouldn't benefit everybody.
No.
So it's kind of the sexual dysfunction patient who comes through with the dyspareunia or the erectile dysfunction, or a lot of the pelvic pain, especially I find in the men. And it's looking at how I treat these. So a little bit, not totally on kind of when you would use dilators, and a little bit mention of vibrators, and maybe you bring a few of them with me. But then talking in around how you get the psychosexual into what you ask. Yeah. Because I find that's one of the big questions, even to sow the seed, that sometimes takes 2 or 3 sessions and then they go with everything. Exactly. So, and I suppose now I have the confidence because I've been training for ages, and now I've got my diploma and I'm training to do my membership. I currently still can't sit it, but I feel by the time I get there, I will be allowed to sit it. So I've started the training anyway.
Fantastic.
Because it will take a good few years. So I just decided I might as well start.
Yeah.
So the experience from that has been incredible and absolutely changed my work. And to be honest, nearly every patient I see in the NHS are the complex pelvic pains, dyspareunia, sexual dysfunction. And practically every one of those, every 3 days a week, it's that. And then the men, it's the same. Most of the men I see are mostly that, some prostates, but mostly the sexual dysfunction and pelvic pain.
I think it's just so valuable to be able to maybe create a forum where just even to learn about how to initiate these conversations, because I think, for us as physios, even working in pelvic health, it can be an area that a lot of clinicians feel a little bit nervous about bringing up as a topic of conversation. But, I think we also have to remember that if we don't do it, who will?
Exactly. And it's so important because very often, and I bet you've heard this too and everyone else, we're the first person who's kind of asked the question. So maybe we might have been the second or third to ask it, but we're the first person who's asked it and listened to the answer.
Yeah. And
that's the big thing, because people go, oh, how's that? Okay, tick box gone. Let's move. And actually, if you pause and leave it, it's amazing what they tell you. And, to me, that's a whole quality of life. It breaks down marriages. It affects a whole bigger picture than just the person in the room.
Everything.
And so I'm just passionate about all of that side of stuff, because I just think it just makes such a difference to lives.
Brilliant. Yeah. And, I think, I'm delighted that you have, we're going to be talking about fitness and exercise, because I think just that whole continuum of lifestyle medicine is important.
Yeah, it's huge.
I'm really looking forward to hearing Elaine speak. I haven't heard her speak for a couple of years, but I think just breaking down the barriers. And I think sometimes for us as physios, we're very good about talking to each other.
Yes.
And possibly less good at talking to the normal people in the outside world.
Yes.
And so I think, again, so I'm really looking forward to not only getting pointers from you about, psychosexual conversations, but just, how Elaine has found engaging people around the topic of pelvic health, and realizing, I think sometimes we live in a bit of a bubble, don't we? And we forget that not everybody knows, not everybody knows there is help out there that despite what the good people at Tenna and Always will tell you, you don't have to commit to a lifetime of pads. It's all, it's almost always fixable, or certainly improvable.
Yeah, no, definitely.
So I think, a big part of the weekend that I'm really looking forward to learning is communication skills, for men, sexual health, using comedy, and of course bringing movement into it. I will be talking about poo, shockingly. I'm going to be talking about, good guts and brilliant bowels, because I just think good bowel health and gut health, it's fundamental for everything. There's some really exciting research going on about the links between bowel health and mental health, on mood and anxiety and depression, and particularly for both men and women with pelvic pain. I think that's huge. But, even looking at IBS and IBD, and what does the evidence tell us about our role in it? So we're certainly staying within scope of practice, but maybe just looking at a bigger picture of incorporating some lifestyle strategies. And you were very brave, and you said I could talk about 2 things. So you may regret that. I'm going to talk about female hormonal dysfunction as well, all the way from dysmenorrhea, painful periods, to PCOS, to endometriosis, to fertility, through menopause. So there's so much that we can do, you know, and again, getting the basics right, what to eat, what to avoid, particularly around dysmenorrhea. You know, there's lots of great research around exercise and TENS and certain food, and really restoring quality of life, I think, to women the whole way through the spectrum is an area that I think as physios, we can actually start stepping into a little bit more, embracing wellness and being proactive about promoting health rather than reacting to a problem. So, and you know I'm a nerd, so it'll be all very evidence-based. There'll be lots of citations, and there won't just be Michelle being woo because she's in Glastonbury, but she is very excited about that. It's going to be, I'm just going to pause. So, can you just remind
paused on me.
Oh, can you hear me now?
Yeah.
And we're back. So,
okay, yay.
Let's just, before the internet gods lose faith in us altogether, where can people find out more about this amazing event and book their tickets to come and see us? Because I know they're selling fast.
If you go to DebbieDillonPelvicHealth.com, that will send you straight to the link. Or my Facebook page, that will send you straight to the links, and all the links, unfortunately, they're slightly separate, just that's the way we had to do it, but it will send you to every one of them. So it's Friday, the 20th of September, and Saturday, the 21st, with Elaine Gussagrippers in the middle on the Friday night.
Brilliant. So a whole weekend of...
Can I give one warning?
Yes.
Everybody, warning, Michelle Lyons will have you buying 101 books, because every time you come to anything, I have my stash.
I thought it was a serious warning.
No, it's a warning, because every time I listen to you talk, I go and buy about another 10 books.
I make no apologies.
I know, but it is always amazing. So they're always really good books. Yeah, so I actually have the endo one in my bag to go to Ireland with for my holidays.
A little light reading for the beach. Good.
Exactly, perfect.
We'll certainly be talking about that, and I will leave everybody with a recommended reading list. I should have bought shares in Amazon all those years ago.
I know, definitely.
Great to chat and catch up, and I'm really looking forward to this event. I've really cut back on a lot of my teaching and traveling, but this was an absolute no-brainer when it came to accepting an invitation to come.
Thank you so much.
Well, you know what, I know if you're in charge that it'll be smooth, but I think, you know, really
no pressure.
Speakers, yeah, it'll be fine. What could possibly go wrong? I'm going to put a link at the bottom here, you know, underneath, so people can click through and buy their tickets, but they are selling fast, so I would encourage you not to wait until it's too late, because this promises to be a fantastic weekend of learning and fun and networking and really refreshing your practice and your outlook. Debbie, I'll see you in a few weeks.
I know, not long. Thank you so much, Michelle, and enjoy the rest of the summer, and we'll see you in September.
All the best. Bye.
Bye. Thank you.